From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Kristin Jankowski. She is a veterinarian, a fellow VMD, and the Director of Veterinary Services for the OpenDoor Veterinary Collective, which is a nonprofit organization that aims to improve access to veterinary care for all pets and people. A lot of their work is focused on supporting veterinary teams through training, coaching, and resources both for their own teams and that they can offer to their clients to improve their ability to accept care for their pets. We talked a lot about access to care, the concept of financial triage to help determine how to help clients afford care in the ways that work best for them, and how veterinary school curricula are changing to help students feel more empowered to practice spectrum of care. Her explanations of spectrum of care and access to care are eloquent and inspiring and really help put it into context as meeting the client where they are using our knowledge of sound medical practices so that more pets get the care they need. I hope you enjoy it as much as I did. Without further ado, getting her time to talk from the soapbox, Dr. Kristin Jankowski. Well, Dr. Kristin Jankowski, thank you so much for being here with us today. So excited to get to know you more and learn about all the things that you're doing. And welcome to the podcast.
Thank you so much for inviting me. Really appreciate being here.
So you are the Director of Veterinary Services, I believe, for the OpenDoor Veterinary Collective. Did I get that right?
That's correct. Yes.
I'd love to know more kind of like how the OpenDoor Veterinary Collective, how it came to be, how you became involved with it, and sort of what the goals of the collective are.
Sure. I started with Open Door about a year and a half ago. I was invited by Amy St. Arnaud, who's the founder of Open Door, and she has been busy in the access to care space for decades and wanted to show how to run practices, provide access to care for people and pets, and remain financially sustainable. So she has two for-practice hospitals, and that's one of the arms of Open Door. And there's a nonprofit arm of Open Door, and that's where I come in. And the goal is to develop content to share out to practices to show them how they can provide access to care to a variety of people and pets, all socioeconomic groups, and show how you can remain financially sustainable and keep your staff happy. And so the for-profit arm shows how you can actually do that in practice. And the nonprofit arm, we develop coaching materials where we can mentor practices. We develop online training materials where we're actually the focus right now currently is getting that material into veterinary schools. So we can get this project started even before the veterinarians hit the ground running so that they come through trained on how to be financially friendly, how to practice across a spectrum, how to have strong relationship centered communication skills. So when they come out into practice and they work for any range of practice, be it a for profit hospital, corporate, private, a veterinary shelter, or a nonprofit, it doesn't matter. But anywhere along there, they're going to have confidence and competence on how to practice across the spectrum, but not give everything away. We wanted to train practices and veterinary students that historically, I think people have thought that if you provide care to folks that have barriers, you have to give it away. And we're saying that certainly there is an arm of the, one section of the public sector that might need grant funding to support their care. But there's a huge center of our country, really the most of people in North America just need a little bit of modification in how they receive care. It could be they just need a spectrum of care practice. They might need payment plans, pay over time, and then they're fully in there. So another part of what Open Door does is provide a network for clients where they can go and say, I need service X. I might need low cost pet food. I need low cost veterinary care. I need co-housing because I'm a victim of domestic violence and I want to go somewhere where my pet can come with me. So the other, the basically the third main portion of Open Door is to run this website called Pet Help Finder, which is designed for clients to be able to go and match where they can get resources all around the US.
I didn't realize that there were those three sort of distinct parts of the collective. I think when I first heard the term, I did wonder if it wasn't sort of a chain of new hospitals.
Yeah.
And I'm wondering, is the goal to grow that part of the business and open additional hospitals, or is it mainly kind of to serve as sort of a reference point for other practices to emulate on their own?
It's a great question. Our goal has been to be a reference point. We want to show other practices how they can do this, but keep their own individuality. We know that practices out there, whether they be corporate with a corporate mission or a small private practice, they want to have their own mission and values. And we totally respect that. And we're not looking to create a chain of practices, but we are looking to say, what resources do you need to be able to provide access to care in your area, to be able to provide families with, care plans that work for them, to be able to provide training for your staff. Maybe you're part of a corporation and you've noticed a high turnover, or a a privately owned practice, and you've noticed turnover of your employees, be them veterinary professionals, technicians, or CSRs. There's a lot of research to show that moral distress is a factor of turnover, and where the professional team wants to be able to provide a care match for a client-patient pair, but they can't. So perhaps that's what your group needs, is training on how you can empower your staff to do that. And so we can provide training modules for your staff so more clients can say yes to care plans that you've offered, that they know how to meet clients where they are. And so clients have that satisfaction rate, and then that trickles back to the professionals. Because if the professionals come home at the end of the day and say, oh my gosh, I was able to really provide care in a tricky situation where I was worried I wasn't going to be able to do that, but I had the background and knowledge to know that if I provided that family with a payment plan, they could afford to, hospitalize their block cat. Or if I provided an outpatient parvo treatment plan, that family could afford to keep that puppy. So all those things where we know that rolls over into how the professionals feel, and then uh, translates to them being happy in their work, and that translates to practice owners or corporations being super happy that they can just meet the needs of their team. We know that as practice, practices function, they want to keep their teams happy and their clients and patients. And so our goal is to be the resource of what do you need to help provide that. And each practice is going to be different in what they need. And so we're hoping to be a resource, library, coach, mentor for all kinds of practices and practitioners.
Thank you. Thank you for that very helpful explanation. And I want to touch on kind of a lot of the points that you've just brought up. The first of which is, and I think we all know, cost is probably one of the biggest ones, but just kind of what do you consider to be some of the biggest obstacles to access to care currently, cost included?
Sure. Cost is, of course, the biggest one. And a lot of publications will show that over and over again, that's the biggest reported barrier to care. One of the next biggest ones is really the availability of practitioners in certain areas. So you might have a remote rural location, or even an urban area where you know, where there aren't enough practices to serve the people and their pets. So it's really the matching of the providers to the needs. And then another big one is just kind of having people being met where they are, having that lack of assumptions about your clients, and having people understand each other. So I understand and trust you, and you understand and trust me. And that can relate to language barriers. That can relate to just making assumptions about people's background or financial ability. It brings into that sort of that cultural humility piece of just being open to varieties of people and finding care paths forward. So the transportation piece is always really big as well, and that kind of fits into our care deserts. What I touched on or alluded to before, where areas of our country that don't have veterinary clinics, facility, or mobile places that are considered a care desert. So transportation solutions can be part of that as well. We're actually working on that as Open Door as well to help connect people with transportation options to get to appointments. So there's a whole range of barriers, but we know that cost is probably the biggest one, and then understanding how to provide care across a range. Because in my experience, working in the veterinary schools and education process, most of the schools are done in tertiary care centers where the most technologically advanced option is what's available, and it's what people are seeking out, which is amazing. And all those technologies have provided fantastic benefits for pets, but a vast majority of our population uh, can't afford those levels of care, yet that's where our veterinary students are training upon. So we're trying to bring in that piece is important and should stay, but also we should include a range of care options that are evidence-based and that are supported by specialists, generalists, the whole, us as partners support these. So that's where our training modules are coming in to help break down that barrier of care is just of the practitioners not knowing how to comfortably practice across the spectrum, how to know that that meets their standard of care in their state, and that that standard of care is not lesser care. It's not just, I think that's a misnomer where people think that spectrum of care, I think is lesser care, and that is not true. It's spectrum care is often uh, more complicated to think about and requires more background knowledge in some ways because you have less information to help you get to the diagnosis. So we're trying to dispel that myth and show that spectrum of care is plain old just good medicine. And that's my goal in a way that spectrum of care won't be a buzzword in 10 years and we'll just call it good medicine.
Yeah, and I feel like spectrum of care really is a buzzword right now. Um, and that I mean that's just what I wanted to ask you about is, you'll see, in terms of blogs, webinars, podcasts, social media, I mean, spectrum of care, sort of that phrase is kind of everywhere right now. But I'm curious and then the other part of it is that a lot of us, even if we don't recognize that term or if we haven't in the past, like have been practicing spectrum of care with at least some of our patients for a while. And maybe we didn't feel like we were doing the right thing, but maybe we felt like we had no choice but to do it. Um, but how do you see, like, in terms of veterinary professionals who are in practice, I mean, how do you see sort of the idea of spectrum of care being embraced or not being embraced?
Yeah, I like what you mentioned there in that many of us, and not, I would say all practitioners that are out there, have been practicing across the spectrum for many years. But as you mentioned, you brought back an important point that many people feel bad about that. They feel like I'm doing less than I should have done this. There's a shame component that we hear, amongst practitioners, and I hear that amongst students, like, is it okay? And we're trying to show that not only is it okay, but it's amazing, and this is supported by even the AAVMC, so the group that manages ideas for all the veterinary schools has just released this spectrum of care guide, to show like as long as you are doing a great job sharing decision making with your clients, offering a range of options, tailoring options to meet the needs of the client, but being open to change, open to modifications. Um, they've released a whole set of guidelines that not only this is good, but we need to be teaching our students this. So people can move forth and say, like, there is incredible evidence to show that ranges of care are a perfect match for many clients that you may have a client that even doesn't have the financial barrier And so they feel guilty not doing the highest technology option, but they just may not elect that for their senior cat, their senior dog, because they don't want to put him through a surgery or something like that. So that's a range of care option too. And I think what we should focus on is that it's good medicine if we're responsive to our client patient pair individually, as long as we're offering options that are likely to have good outcomes, and we're sharing options that are more technologically advanced as well as less, so giving the client a range of choices and then empowering them to say, this feels good to me, and I appreciate that you met me where I am, and that I have just paid off braces in my 14-year-old, and my interest rate on my house just went up, and I really wanna do the dental on my dog, and the fact that you offered me a payment plan to do it means I can, and I will, versus saying, like, "Here's an estimate, payment required at the time of service," and end of the financial discussion. So we do things like ranges of care, ranges of financial discussions, all those things. So it's a complicated topic because it involves more than just care plans. It involves how to do them. It involves being comfortable about talking about finances. And that's why we created these multiple courses and have tons of experts on our course to chime in their individual area of expertise because we know people want to hear the liability piece and like, is this a liability problem? No, you need to document, offer recommendations. So we go through all parts of these things on our courses, and we encourage you to take a look and see if any of them meet your needs.
Awesome. And you kind of touched on vet schools. I want to talk a little bit more about spectrum of care in veterinary education because I think a lot of us can sort of identify with the sort of the ivory tower way of thinking, like you mentioned, where most of the patients who are coming into these tertiary referral facilities, they're coming because they need more either expertise or access to equipment or diagnostics or surgical procedures, hospitalization, things that can't be offered elsewhere. So students are often being exposed to the clients who are only the clients who are willing to do practically everything, if not everything, that they could possibly be offered or recommended to do. And so we get a little bit of that sense of this is what it means to be a good vet. And I can remember instances when I was on my rotation where I was in the on the ER service, and a patient had been referred from uh, a local DVM, and the ER clinician was being very critical of the way that the referring DVM had prepared the patient for a referral and looked at all of us students and said, don't ever do this. I don't want to ever see you go out into practice and, refer a patient like this. And that may have been helpful advice, but it also kind of made us kind of fearful that we would not be good enough if we were not doing, everything sort of the way that we learned in vet school. So you mentioned it that this you're trying to also get the message across to students kind of from the very beginning of their education. Can you talk more about that? Like how we're helping them see that a spectrum of care is okay? Because I feel like that's when a lot of veterinarians are going to want to practice very defensively, um, maybe out of fear or anxiety that they will let their patients down, let their clients down, let their mentors down, let their profession down, wherever that comes from, and or open themselves up for, liability, criticism, all of those things. So how is that messaging going across to veterinary students?
I'm so glad you asked that. That's really where my heart and passion is in this regard because as a veterinary educator, I saw students and they directly express all the fears you just mentioned. I feel like I'm going to be letting, my profession down, my faculty down. I'm going to be, you know, I'm fearful of litigation. And so we took all that information And we're like, wow, we really need to help drive this forward. How are we going to do that? Because we know that veterinary students look up to all their professors and faculty, rightfully so. They're amazing folks that are doing education throughout our schools. And so we realized that we need to talk to those professors too and have them learn a little bit more about spectrum care, have them have the chance to ask questions so that the ones that are teaching it can feel comfortable. And we also probably need to bring in some more resources for the schools so that spectrum of care can be taught alongside the tertiary level care. Because we want those students to know about that too. And by no means do we feel that that is unimportant. That's a big piece for them to know kind of what the latest technology is. But we also want them to understand how to help all other cases that may not be able to meet those needs of that high technology option. So that's where we created several courses that are now being utilized in at least 9 veterinary schools. And we were able to provide them for free due to grant funding. So, because we know it's hard for faculty members to have the time to create new content, they're super busy doing all their passions, whether it be cardiology, orthopedics, dermatology, and we don't want them to stop. We want them to keep going and do all those amazing things. But we thought if we gave them tools to partner with general practitioners, specialists, people working with the state boards, and we offered it to the schools, they could have the choice and flexibility of where to fit that into their curriculum to help those students and that show that partnership and collaboration too with groups that are promoting access to care. And we thought that would be very powerful. And so we've had some great feedback so far. We're starting some research to measure the impact on the students. We're hoping to not only give them confidence and competence along the spectrum of care, but to be more just comfortable moving forward and stay in the profession longer. We were seeing a lot of these cases are leading to moral distress, just like what you were saying. Like I feel like I've failed, a number of things, my profession, my faculty. And I've actually seen students who are now practitioners leave clinical practice in the short period of time when I started at Davis 5 years ago. And I'm now there as affiliated faculty and still will keep up with some of those students. So we that's what we want to avoid, right? We want to have those folks stay in practice, love their work, feel like they're making an impact, know they're making an impact, and also know that they're able to, pay off their student loans. So that's a big piece too. We don't want them to sacrifice themselves for the good of our profession at every turn. We want there to be a balance. So these programs that we've created are going out into schools. And if any of you are faculty listening and want to reach out on how you can get that into your school, feel free to reach out, and I'm happy to provide that information. We're hoping it just can make one step to make it easier for students and for universities, because we know that everybody's busy. And if we can do a little chunk to help out, we're happy to do it.
AhaCon 2025 is more than just continuing education. It's your chance to take your career to the next level. Earn race approved CE credits, engage with industry leading experts, and gain fresh perspectives to bring back to your practice. Hear from powerhouse speakers, plus enjoy unique experiences like live pet portraits, charm bracelets, professional headshots, resume reviews, and much more. September 11th through 13th in downtown Chicago on the Magnificent Mile. Don't miss this transformative event. Learn more at c.aha.org. That's the letter c.aha.org. Looking for the latest veterinary news? Stay ahead of the curve with stories from the American Animal Hospital Association's digital, award-winning newsroom, Trends. We're bringing you fresh stories every day, covering everything from the cutting-edge clinical insights to helpful practice management tips. And it's not just articles. Watch videos, check out interactive charts, and learn more about the people shaping our industry. As an AHA member, you also unlock exclusive members-only content designed to help you and your team thrive. Visit aha.org/trends today and sign up for Trendsetter, our newsletter where all of our stories are delivered to your inbox twice a week.
I want to really kind of touch on the idea of cost as you said, often the biggest obstacle to care for a lot of pet owning families. Um, and I feel like it's such a tricky one because I think we can all acknowledge that veterinary care can be very expensive. And at the same time, we have to pay our teams and in many cases feel that there's room for improvement in how we pay some members of our team, at least in comparison to how they've been paid in the past and maybe how they're being paid now, and the cost of goods in terms of what the practice has to pay is probably only going to continue to rise. I feel like that puts a lot of veterinary professionals in this very uncomfortable sort of conundrum of they probably can empathize a lot with pet owners and wish that it didn't have to cost what it costs and wished that it were easier for them to afford, but at the same time don't feel like they have very much room for movement there, and certainly don't feel like, as you mentioned sort of at the beginning of our conversation, that they should be giving away things for free because what they do and their expertise and their time, all of that is valuable. Um, so how can we start to at least kind of think about that in a way that would move the needle forward on that?
Cost is, as you mentioned, is a big question, and we definitely want practices to get paid for their services. You Veterinarians work long and hard for their education. Technicians are amazing, and we all know we could not function a day in clinical practice without an incredible team of technicians and client service representatives. Like that, it's the team that makes it work. So, what we're trying to coach practices on how to do is learn a range of skills that help your practice get paid, that so that your clients can be met where they are, but you can still compensate your teams and pay your bills. And some of those things involve coming up with these spectrum of care ranges of practice, which may sound, when at first people are like, well, if that involves a less expensive option, however, am I going to make any profit on that? But if you think that if you provide an estimate for, I just heard recently of an estimate for $8,000 that was given for a block cat to be hospitalized for 2 days and unblocked without surgery in the San Francisco Bay Area. So let's just say you gave that estimate to the client. They are upset, they can't do it, and they walk out. No money is given to your practice, although I'm sure you spent a lot of time coaching them on that block cat. If by, a different method, you offered a pay over time plan, where we have studies to show that, not even doing a hard credit check, that those clients will pay. There's different groups that can help it make it successful for your practice. Millennials are accustomed to paying for just about everything over time, and they are your largest pet owning population right now. As we all know, you can buy shoes and pay for it over time. You can buy anything and pay for it over time. So if you offered that same block cat owner an opportunity to pay over time, and perhaps you still had the high estimate, and in your area that was accustomed to your socioeconomic level, that may have them say yes to your care plan alone. So it can be as successful as that. Or if you're in a range where folks have more limited options and you offer even an outpatient, care plan, you unblock them, you might do some, evidence-based, spectrum of care plan, but you've made that client happy and you didn't have to euthanize your cat and then their cat, and then they give you a positive review on whatever forum that they're reviewing. Tell them, "Oh my gosh, my veterinarian met me where I was. They did not judge me for my inability to hospitalize my patient." It's that positive outcome that you're still bringing money into the practice doing a spectrum of care way versus if that client left, you would bring no money in. So those are just a case example of showing that you can do a range of things that are going to be, we hope, better than the way we all used to practice, which was here's your estimate, pay at the time of service, or there's no other option. So we're trying to show that there are options available that break down these barriers, that allow more clients and practices to feel happier and met where they are. You also have to involve efficiencies of practice. So we're really encouraging teams to do that and mentoring them how to use your technicians and your CSRs to their highest level of practice, which shows study time and time again that those folks are usually happiest when they're also working to the highest level of their license. It's a greater mental challenge for them. So it's a combination of things to get to that ability to pay for care plans. Once again, we're not saying give things away. We're not just saying that you shouldn't be paid for your incredible education and your team should not be compensated. They should be. You should be compensated, your team should be compensated, but we're giving you tools to show how to do that. And it's not just one tool. So it's not a one size fits all. It's a range of tools. And the more you have in your tool belt, right, the more folks you'll be able to help and the better you'll feel at the end of the day.
And I've heard you mention the idea of payment plans a few times, and I feel like that's something that I don't hear as much. I don't hear a lot of talk about that these days, other than from individuals who are saying, "Oh, we tried to do that and then we got burned." People said they were going to pay us. They swore up and down they were going to pay us, and then fell off the face of the earth. We never heard from them again. When you talk about payment plans, are you talking about third-party financing, or are you talking about sort of in-house payment plans? Are you talking about both or something else?
It's a great question. We're not talking about in-house because we don't want your staff to do any more work other than the veterinary practice running. We're talking about third-party payment plans, which have shown great success. We have some research that we've done partnered with PetSmart Charities, producing a research paper on that, and we have current research going. We also have an opportunity for 500 practices to join us in our next project. So if anybody's really interested in this, we're about to launch the next one to show that these third parties will guarantee your practice gets paid, kind of using a multiplier effect. So you can, if you take our courses, we can go into details on how that works. But if you think about it, and every practice when audited will show that they're giving some things away, and that's because we are a compassionate profession, right? We want to help people and pets. But if you take that money that you're giving away and instead put it towards your third party um, groups helping you, you can exponentially increase the amount of money you're able to offer to clients. And our studies show that even though these third-party payments don't involve hard credit checks, that they get paid back. So your practice is going to get paid, and your client is not going to suffer for their credit score. Typically in veterinary medicine, we're familiar with care credit. That's probably the one that if you've heard of a credit option that's done outside of your practice. Um, Unfortunately, that involves a hard credit check, and so that can be really problematic for folks that have credit issues or they don't have a permanent place of employment for very long or a permanent residence for very long. Um, so these newer ones that are Verity is one of them, Vet Billing is one of them, and they have shown incredible results um, by letting your practice get paid. Your practice does not have to deal with the management of it, and the clients and patients can get their services. Now, that doesn't mean you could put all of your clients on a payment plan, and so that's why we talk about a financial triage, where one set of your clients can afford the care that you offer. Great, especially if you offer a spectrum of care. They're good to go. Another third of your clients, they might need that pay over time. That could be the millennial that's there with they have a new car and so they've got a car debt. They've got still student loan debt of their own, but they really want to care for their pets. And if they can pay for it over time, fabulous. Then you might have a section, maybe as much as 1/3 of your clientele that really is suffering right now. They've lost their job, whatever is going on, that they might need a group to help them with a grant support. So that's where you're going to have your angel fund type thing that your practice has set aside money for. So if you triage into those three different groups, you'll find that you can be successful and you can decide with your own practice what percentage can go in each group. You might decide for your practice that you only want a small portion in the angel fund because that's all you have. That's fine. You want a small to medium size in that payment plan because that's what you're willing to do. That's great. And you want the majority or percentage to be in that spectrum of care. I can do a range of care options that's going to work for them. Anything from the high level tertiary care to mid range to, maybe a more abbreviated outpatient protocol. All that you've done that are good medicine plans. So that's where we're trying to help you to show you. And that's why I think that Open Door, sometimes when friends are like, Open Door is doing so many different things, how do you keep it all straight? And can you manage all those things? And we've talked as a group and we're said because they're all so interrelated, we feel we need to. So we need to do the training, we need to do the mentorship, and we need to help people connect with practices that are doing this. Because without that, without us doing the financial payment plan research, we can't prove that it works. Without us getting into the veterinary schools and showing that those students are doing better, we're not going to be able to show that we're helping the next generation and beyond feel comfortable doing spectrum of care, talking about money. So we kind of felt we had to do all these little bits to move the needle, like you said. We're super excited to be given the opportunity to try to move the needle. And I think the more people that get in and think like, I can be part of that collective, like I can help in my little piece, we'll all move farther because that's the goal. And that's part of why we named it the collective is because we want everyone to join in and be like, this is the piece that I feel good about. I can do this piece. And well, that piece doesn't fit my, situation, but I can do this other piece and move the access to care needle a little bit. And it doesn't have to be one size fits all. We know we're all super individual. The vet schools are all individual. Practices are all unique. But we wanted everyone to feel like they can participate in a way that feels good to them and just honors their personal mission statement and their practice's mission.
Excellent. Yeah, I'm glad you brought up the financial triage because I was looking at that on the website and I thought that was really really interesting. And I was going to ask you about it, but you answered it kind of how once we know what group which of those three buckets kind of a client fits in, what do we do from there? And you kind of talked about how to decide what kind of help, assistance, changes in what you offer um, they might need. And as you said, not everyone will necessarily need that, but um, kind of the helpful way and terminology that we can all resonate with.
Yeah, we all get used to the triage. If we think about it in the financial triage and just taking away the stigma of it, that it's totally we should start talking about money early. We're encouraging folks to put it on their website, be transparent about pricing, about I know that was super hard piece for when I was directly working with the veterinary students. Like, are you ready to talk about the money? They're like, no. I'm like, you can do it. Like the client is gonna feel better. I was like, pretend like this is you now and this is your dog. Don't you want someone to be really upfront with the costs and the ranges of options and not make you feel bad? And they're like, of course I do. Like, okay, then let's do it that way. Pretend like you're talking to your mom, your brother, your best friend, and they want these answers, and you're going to present it in a way that's you're not making any assumptions, you're just offering them ranges, you're offering them support, you're doing active listening, you're doing reflective listening, and everyone will feel better.
And the other thing that you just talked about a minute ago that I wanted to sort of ask more about is just like you said, this idea of it being a collective and everyone can kind of come and take from it what they need and what they think works for them. Can you just sort of summarize the different ways that veterinary professionals can choose to get involved if they want to?
Yeah, we are trying to make it, as I mentioned, as open and welcoming as possible, kind of sticking with our open door mission. And that we want everyone from specialists, generalists, shelter veterinarians, technicians, CSRs to all feel part of this mission. Our country is in a really challenging place now with meeting the care needs for people and pets. And that we know unless everybody chips in a little bit, we feel that this could be a very scary chapter. As people aren't able to get care for their pets, it makes them very distressed. So even just supporting concepts is you can start with as simple as saying, I really like this idea, and I want to think about doing financial triage in my practice. Or I really love the idea that spectrum of care is good medicine, and I want to share that as a mentor to my new graduates. Or I want the new graduate to share it with me because they had the training in veterinary school, and I'm open to this new idea and how I can provide a range of care options. We think of it as almost like an allyship. Do you know what I mean? Like being an ally to the mission is being part of the collective, doing any of the trainings that help you become more versed in the information, be able to be curious, really just a curiosity about access to care and spectrum of care and a willingness to learn more. In my mind, that makes you part of the collective because I think we don't know what we don't know. So we don't know how we can help others unless we're curious. We ask a lot of questions. We try to get more information, train up in areas where we may have not been trained just because of the era in which we went to veterinary school, technician school, or we're trained by our practices. So I think we really are trying to make it so it's very open. We're working on a certificate program too, so that people could get a certificate program. We want you to watch for a lot of new things that are hopefully coming out of our website starting this summer of different ways that people can get involved to say they're part of the collective, and then can take it to their own personal level of interest. If they want to do a ton of training and really be involved with mentorship, great. If they just want to dip into it and learn some of the terminology and use our glossary of terms, which is also being used by the AAVMC, which we're excited about, just learn some new terms. It's like anything you don't know anything about, but you're a little scared to dip a toe into. Like, just, I think, take that first curious step and see where it leads you.
I was kind of looking around the website and I saw that there were some free CE courses on different topics. And then it also seems like there's some like paid mentorship and paid trainings. Particularly there's a veterinary practice management course. And then it looks like maybe some other one-on-one consulting opportunities. So it seems like there are options for you to just kind of go and take from the site without necessarily contributing anything financially. But for those who want more sort of in-depth training, they can sign up to pay to receive that. Um,
Yes, there's a lot of options. We try to break down the barriers for our professionals too. And we're working on grant support to offer as many of the courses as we can at low cost or even no cost, so that everyone has an opportunity to learn more. So some of those are free. We have a lot more things that we're just about finishing up that we're offering out. We just finished a partnered course with the American Heartworm Society on how to prevent, diagnose, and treat heartworm disease for everyone. So we're really excited that the launch of that will time with their triennial meeting this fall. So keep a lookout for that. We've also are working on micro learnings. So we know that professionals are super busy. And so we've developed some content in 15-minute learnings. So you can do just in time learning. And we're doing those on specific disease states that you can practice across the spectrum. We're partnering with some fun folks there, making sure we have lots of area experts on those. So you can look out for those being on the horizon. And those will be available. All those different combinations will be available on our website soon. If you'd like to get on the website and get on our mailing list, you can be the first to know about all the new releases that come out. And we're thinking about offering, if they're not free, a lower price for being an early curiosity adopter person if you really want to get on and learn early. So all these things have been in the works for us, and we're excited about their launch this summer. to look out for those on our website.
That's really interesting. And one other area that I was particularly curious about is the social work hub.
Mm.
Um, so I was hoping you could explain more about that. I mean, is that more of a place where veterinary professionals can like access a social worker, or is it like who are those resources meant for?
They're meant for a variety of folks. So they're meant for social workers in general, but also practices that are really interested in doing their due diligence on the people side, because we know that access to care truly is a people issue, right? And so if people are having issues of their own, then it rolls into issues with their pets because people are the one caring for companion animals. So I have a love and a history of projects in One Health, and so that ties in to some of my work there, where we're trying to involve just the awareness of the human side of the equation and how we can make sure that we're addressing needs and the interconnected needs of people and pets together. I think that especially affects our most vulnerable populations where they might have to choose between housing situations that take a pet or don't. If they have limited income, they might not be able to put a pet deposit down. And, so we have a whole range of options on trainings there. And I think as we open our eyes to that interconnection, the One Health aspect of access to care, we felt it was important to really highlight that connection further and allow more training in that space, because I think that's something that in the veterinary world is not been at the forefront of our education, really. Because, like you said, we're often being trained in these institutions where that's not, our clients aren't facing that unless we're doing a community outreach clinic, which the schools often do, but not every school has that. So, and we're trying to show that this isn't for the extremes. It's not just for instance, people facing homelessness. This is for everyone. I mean, they'll show studies that people won't admit themselves to the ER if they have a pet that they can't get care for immediately because they're going to go home to their pet, and this is all ranges of folks, so we're just trying to use this social work part to help highlight all the interconnections of people and pets and allow veterinarians and social workers to get more information there. And we're hoping to intertwine our educational opportunities a little bit more over time.
Yeah, I think it's really interesting because you hear things about veterinary social workers. I've read about it, I've written about it myself, and I've done some research for different projects that I've worked on. And so I'm sold on the benefits of veterinary social workers being part of our industry, but have always still had the lingering question of like, okay, well, where are they? How do we work with them? How do we find them? Like, how do we access them? So that's why I was curious to see if maybe this was one of the places that veterinary professionals working in the field can sort of come to get more information, particularly if they're, in an independently owned private practice. They're not part of a big corporation that maybe has their own veterinary social worker on staff. Is this somewhere where they could potentially connect with someone about a specific concern that they're trying to assist with one of their clients or access resources and that kind of thing?
Yeah, we're definitely working to make all those connections, and we've been lucky to be on some of the bigger publications that are coming out about, you know, what questions should be asked of clients that were experiencing access to care, or just good questions about making sure that we're addressing that. And we also have a connection with the Program for Pet Health Equity at University of Tennessee, and they're a big player in the veterinary social work, and they're the ones partnering with us to do our research measuring the impact on the students. So, as we mentioned, all these problems of care are so intertwined. We're hoping the solutions will be better if they're collaborative. So, more minds coming together on integrated projects, we feel is an opportunity for a win for everyone.
Yeah, I actually just met with Dr. Michael Blackwell recently for the
Great. Yeah.
podcast, and yeah,
Yeah.
his work is definitely very inspiring. So
Yeah. And he's on our course as well. Yeah.
wonderful.
He. Mhm.
And just kind of staying with that social work theme, I saw that there were some trainings on emotional support animals for veterinary professionals, and I'm wondering, kind of where the need and where the drive of that is right now. I mean, is it still, at least at one point, it seemed like everybody was trying to get their vet to fill out some kind of paperwork saying that their, dog could be an emotional support animal and fly with them and that kind of thing. And I feel like a lot of that's changed now that a lot of the airlines have really clamped down and adjusted their rules. But like, what is the relationship between veterinary professionals and this need or desire for emotional support animals at this point? Like, is there still some friction? Are there like challenges there that sort of drive the CE on that topic?
You bring up great points because historically, I think in our profession there has been a lot of friction and challenges. And I think it's like anything else due to just a lack of awareness and understanding. Um, and our world is an anxious place right now, too. So we're finding an increased need and request for emotional support animals. Although many of us that are practicing weren't really trained on how to determine the needs and how to determine how to do your paperwork for it and how to do it ethically and how to be transparent with folks. And so we realized that there was a need, both, it seems like there's an increase in demand, and then there's a lack of information out there of how to make it through that demand. So we thought, okay, this is the perfect spot for us to bring in an area expert that's done a lot of work in that area, Dr. Janet Hoy-Gerlach. And she has works with national social worker groups to help, set the bar on how these things are done. And we're really appreciative to have her expertise to help us have these trainings available for veterinarians. So we just know that there's a need. Just like you said, I know like when I was in practice, people would, they would be almost eye rolling that this needed to be done. And I think it was just from a lack of information. So I think big, one of our big things at Open Door is don't make assumptions about people and their needs or their past or their future. Just try to meet them where they are and share great information and move forward together. So we're just trying to provide information so that as a care team, you can be the best care team member there. Or you can basically make it to the care team because we all know that client patient pair are the best two, and you're lucky to be the third to join the team. So if we have the right information and right coaching from the social work side, we just figured we could reduce frictions, provide correct information, and then allow professionals to make individual choices that work best in their practice.
That makes a lot of sense. Yeah. Um, well, you've given us so much great information, and I'm really excited for more people to kind of learn about the Open Door Collective because I really feel like I learned a lot about it just preparing to meet with you. So I'm excited for others to see the resources that you have out there and see what comes next to the website and all the adventures that you're working on. And just kind of closing our discussion today, I wanted to ask, like, what's one thing that you're excited about in the veterinary industry? Either something that's like already happening now or something that you're excited about for the future?
I think I'm excited about more practices realizing they can be part of this collective mission without it being something that's just working towards a population of severely financially affected individuals. I think just knowing like we are all in this together and all of our wishes for clients and patients are all the same. We have the same mission. We want happy clients, happy people. And that's whether we work in a corporation, a shelter, a general practice, wherever. And I think it's exciting to have more people realize like, oh my gosh, this is all of us together. And if our profession is going to get stronger and we're going to feel happier as professionals, we all need to have at least a little bit of information in this area. And I think it's exciting to see ranges of folks realize like like you said, all the buzzword now. People are like, this is something that we all need to know about a little bit to feel like we're doing our piece and feeling better. So I think it's really exciting that it's not just in the trenches anymore of a little subset of folks, that it's becoming mainstream. And like I said, I think if the spectrum of care and access to care just becomes good medicine in the future, I'll be thrilled, because it really is just great medicine. It's just meeting the needs of client-patient pairs and taking into our own considerations at the same time, making sure that we're happy too at the end of the day. It's exciting to be able to help even just one person or one practice see that. So I'm happy to be part of it.
That's an amazing answer, and I'm so glad that you're doing the work that you're doing and sharing it with us, and I'm excited for more people to learn about it too.
Thank you so much.
Thank you for spending the time with us today, for sharing all of your insight with us, and looking forward to everyone else hearing about it.
Appreciate the opportunity. Look forward to talking more.